That tiny cut on your finger? In normal life, it's nothing. You rinse it, maybe slap on a bandage, forget about it by dinner. But when hospitals are gone, when antibiotics aren't a refill away, when clean water is a question mark, that same cut quietly starts a countdown. And here's the truth nobody likes to talk about. In collapse conditions, it's not explosions or gunfire that erase most people. It's small injuries that spiral when the safety net disappears. Listen carefully, because survival isn't about being fearless. It's about understanding how fragile the human body really is when modern medicine steps away. The first danger hides in plain sight, small cuts and scrapes. The human body is basically a warm, wet ecosystem, and bacteria love it. In normal times, infections are annoying. In collapse, infection is a predator. Once bacteria enter a wound, they multiply fast, releasing toxins that trigger inflammation. Your immune system responds by flooding the area with white blood cells, heat, swelling. That's fine until it isn't. Without antibiotics, infections can spread from skin to blood, turning into sepsis. That's when your own immune response goes into overdrive, dropping blood pressure, starving organs of oxygen, and shutting systems down one by one. People imagine infection as something dramatic. In reality, it often starts quietly. A little redness, a little warmth, then fever, confusion, weakness. The survival insight here isn't learning to play doctor, it's understanding that prevention beats heroics. Clean wounds immediately. Protect them obsessively. In a world without hospitals, cleanliness becomes a life or death skill, not a hygiene preference. Next comes the injury nobody takes seriously until it's too late. A twisted ankle or a minor fracture. You step wrong, you hear nothing snap, you can still walk, sort of. So you push through it. But the physics of survival are brutal. An injured joint changes your gait, burns more calories, slows your movement, and makes you unstable. That means more falls, more injuries, more exposure. If swelling cuts off circulation, tissue starts suffering from oxygen deprivation. If you're forced to keep moving, micro-damage compounds into serious structural failure. And then there's infection again. Closed injuries can hide internal bleeding or tissue death that becomes a breeding ground for bacteria. In modern society, imaging and immobilization prevent that cascade. Without them, a minor injury can quietly remove your ability to travel, gather, or escape. Survival isn't about toughness here, it's about respecting biomechanics. If mobility goes, options go with it. Then there's the one that ends people faster than almost anything else. Dehydration caused by mild diarrhea or vomiting. It sounds ridiculous until you understand the math. The human body is roughly 60% water, and it uses that water to regulate temperature, transport nutrients, and keep electrical signals firing in your nerves and heart. Lose fluids faster than you replace them, and blood volume drops. That lowers blood pressure, reduces oxygen delivery, and thickens the blood. Electrolytes fall out of balance, and suddenly muscles cramp. The heart rhythm destabilizes, and mental clarity collapses. In a hospital, IV fluids solve this quickly. Without one, a stomach bug can become lethal in days, sometimes hours in hot conditions. The overlooked survival science here is that water alone isn't always enough. Your cells rely on sodium and glucose to absorb fluids efficiently. When collapse hits, understanding hydration becomes as important as finding food. Another silent killer comes from something as ordinary as a burn the size of your palm. Not a fireball, not an explosion, a cooking accident, a tipped candle. Burns damage the skin, which is your primary barrier against infection and fluid loss. Even small burns cause plasma to leak from blood vessels, leading to dehydration and shock if unchecked. They also create dead tissue, which bacteria colonize rapidly. Pain masks severity, and swelling can restrict movement or blood flow. Without sterile dressings, pain control, and monitoring, a burn can progress from manageable to systemic failure. The body diverts massive resources to repair damaged tissue, weakening immune defenses elsewhere. Survival isn't just about avoiding burns. It's about understanding that skin loss is infrastructure loss for your body. The fifth injury is the most underestimated because it doesn't bleed. A simple puncture wound, a nail through a shoe, a splinter driven deep, animal teeth. Punctures are dangerous because they close at the surface while trapping bacteria deep inside. Oxygen-poor environments are perfect for certain pathogens, including ones that cause muscle spasms, paralysis, and respiratory failure. In modern times, vaccines and antibiotics neutralize this risk. Without them, the clock is ruthless. The danger isn't dramatic pain, it's delayed symptoms. Stiffness, jaw tightness, trouble swallowing. By the time you realize something is wrong, intervention options are limited. The survival insight here is counterintuitive. Wounds that look small can be more dangerous than wounds that look ugly. Depth matters more than appearance. What ties all of these together is a reality most people don't want to accept. Collapse doesn't kill you loudly. It kills you through logistics, through delayed consequences, through biology doing exactly what it evolved to do in an environment that suddenly stopped being forgiving. Movies teach us to fear the moment of impact. Real survival demands fear of what happens after. Here's the mindset shift that keeps people alive. You stop asking, "Can I push through this?" and start asking, "What does this cost me tomorrow?" Energy, mobility, hydration, immune function. These are currencies. Spend them carelessly and you go bankrupt fast. In a world without hospitals, survival becomes conservative, not aggressive. You don't win by taking risks, you win by avoiding cascades. And this is where dark humor sneaks in, because it has to. Humanity built skyscrapers, satellites, and nuclear reactors, yet remove a few antibiotics and clean water systems, and a blister can end the story. That's not weakness, that's biology. You are a complex system balanced on maintenance. Take maintenance away, and entropy takes over. So when you think about preparation, don't just imagine weapons or bunkers. Imagine clean water, foot care, skin protection, hydration knowledge. The boring stuff. Because after the collapse, boring is what keeps you breathing. And the people who survive aren't the ones who look the toughest on day one. They're the ones who understand that the smallest injuries deserve the most respect when help isn't coming.